Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we'll look at cardiac output, one of the most important concepts in cardiovascular physiology. We'll define cardiac output, learn how it's calculated, discuss the factors that influence it, and explain why it is essential for oxygen delivery. Let's begin with the definition. Cardiac output is the amount of blood the heart pumps each minute. It is typically measured in liters per minute and represents the amount of oxygenated blood delivered to the body's tissues. Because oxygen delivery depends on blood flow, cardiac output is one of the primary determinants of tissue perfusion and exercise capacity. Cardiac output is calculated by multiplying heart rate by stroke volume. Heart rate is the number of heartbeats each minute, while stroke volume is the amount of blood ejected by the left ventricle with each beat. Together, these determine the total amount of blood pumped every minute. Normally, the heart pumps approximately 5 liters per minute at rest, and up to approximately 25 liters during exercise. Building on the cardiac output equation, let's first look at heart rate. Heart rate is the number of beats per minute. A normal resting heart rate for adults ranges from 60 to 100 beats per minute. During exercise, heart rate increases to help the heart pump more blood each minute, increasing cardiac output and oxygen delivery to the working muscles. Now, the second component of cardiac output is stroke volume. Stroke volume is the amount of blood ejected by the left ventricle with each heartbeat and is measured in milliliters per beat. At rest, stroke volume averages about 70 milliliters per beat, but it also increases during exercise, allowing the heart to pump more blood with each contraction. In another PT microlesson, we'll take a closer look at the factors that determine stroke volume, including preload, afterload, contractility, and ejection fraction. So, what does this mean clinically? A normal resting cardiac output is about 5 liters per minute, which provides adequate tissue perfusion to meet the body's metabolic demands. During exercise, cardiac output increases substantially to deliver more oxygen to working muscles. In contrast, a low cardiac output limits oxygen delivery and may result in fatigue, dizziness, exercise intolerance, and signs of poor tissue perfusion. Let's summarize the key points. Cardiac output is the amount of blood the heart pumps each minute and is calculated by multiplying heart rate by stroke volume. A normal resting cardiac output is about 5 liters per minute, and it plays a critical role in delivering oxygen to the body's tissues. As we learned in the previous lesson, cardiac output is one of the two components of the Fick equation that determines VO2, making it essential for oxygen delivery and exercise capacity.
That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.